No matter what happens to President Obama's health care reforms after the November elections, the disjointed, costly American health care system must find ways to slow the rate of spending while delivering quality care. There is widespread pessimism that anything much can be achieved quickly. But innovative solutions are emerging in unexpected places. A healthcare system owned and managed by Alaska's native people has achieved astonishing results in improving the health of the enrollees while cutting the costs of treating them. At a recent conference for health leaders from the United States and abroad at the native-owned South Central Foundation in Anchorage, the Alaskans described techniques that could be adopted by almost any health organization willing to transform its culture. Such a transformation would require upfront financing for training, data processing, and the like. But the investment would and should rapidly pay off reduced costs. The foundation, established in 1982, provides primary outpatient care to Alaska Natives and American Indians who had previously been the responsibility of the federal government Indian Health Service. It serves 45,000 enrollees in the Anchorage area and 10,000 more scattered in remote villages, most reachable only by air on an annual budget of $200 million. It also jointly owns and manages with a consortium of native tribes a small hospital and has built a modern campus of outpatient clinics with the help of loans, grants, bonds, and retained earnings. About 45% of its revenue comes in what amounts to an annual block grant from the Indian Health Service, a source unavailable in most health systems. Another 45% comes from Medicaid, Medicare, and private insurers, and the rest from philanthropy and grants. As the Commerce Department noted when it gave South Central a National Quality Award in 2011, known as the Malcolm Baldrige Award, the foundation has achieved startling efficiencies. Emergency room use has been reduced by 50%, hospital admissions by 53%, specialty care visits by 65%, and visits to primary care doctors by 36%. These efficiencies, in turn, have clearly saved money. Between 2004 and 2009, South Central's annual per capita spending on hospital services grew by a tiny 7%, and its spending on primary care, which picked up the slack by 30%, still was well below the average of other municipalities. The team members sit in the same small work area and communicate easily. When a patient calls, the nurse decides whether a face-to-face visit with a doctor or other health care provider is required or whether counseling by phone is sufficient. Integrating a wide range of data to measure medical and financial performance. South Central's data mail coughs up mostly understood graphics, knowing how well doctors and others are performing.
That's fine.